All right, so how did we know that we were going to peak in early to mid-April? This is back in March when I was looking at the data, and that we're unlikely to overload our healthcare system en masse. The short answer is that almost everybody should have known this. Just looking at a SEER-based model, we should be able to know based off our first detection of a case in January, as well as our first death, where we were roughly on the curve, because transmission rates are pretty widely known. We can debate whether they're 2 or 3 or 4 or not, but it was definitely a fast-moving virus. We know more now. But so the one thing that we probably didn't know very well and that I had to adjust for was hospitalization rates as well as mortality rates, because there's a big numerator denominator problem. I call it the undetected rate. It's essentially at any early point of any epidemic or pandemic, you find that you're tracking the worst cases, right? So you're tracking fatalities, you're tracking hospitalizations, and maybe some of your mild cases, but largely it's heavily biased towards the worst outcomes. All right, so how can we figure out what our true denominator is, and therefore adjust our hospitalization or fatality rates to represent what's likely to occur? I like to say the best predictor is oftentimes the past, what's happened. And so if you look 10 years ago to our last pandemic or epidemic, it was a swine flu, and we were off by 23x 3 months into the US, similar to where we were at this point in time with COVID. Go even out 12 months, a full year of data testing. They had over 7 million confirmed cases worldwide, which is more than we have right now for COVID. They knew a lot at that point, and they thought the death rate was 0.3%. Well, it came in at 0.02. We're missing 10x our denominator. So that's a good litmus test for us there. Secondarily, I'd say Diamond Princess Cruise, where they had a captive population. They tested almost everybody. Rough orders of magnitude compared to where we're at in the US is about 10x off. Iceland, they're testing a lot of folks. Similar story, about 10x or more, depending on what other countries you're comparing it to. And then the CDC data of onset data, our own data, guys. There's a lag in terms of when we know about things. It takes time to get things sent through the testing protocols and to get reported and added to the reports. So at any given time, when you're looking at date of report, which is basically you should never use for trend analysis. So please, if you're using it, stop it. But if you look at date of report, and I'll show you an example right here, on March 17th, we thought we had 7,000. The blue line is what we knew. The CDC reported 7,000 infections in the US. Okay, well, actually we had 70,000 infections, but they didn't realize that until they got all the data weeks and weeks and months later, and then they did investigations to figure out when those, roughly when they think the symptoms were first occurring, and then they figured out how far off they were. So historically, look, we've been 10 to 20x off through the early part, and actually up to 50x off in terms of our own data, which again may only be 5 to 10% of what's actually happening. So you have these two confounding multipliers of delay in reporting, and then we're only capturing a small percentage in our reporting even after all of this. All right, so I took the undetected ratio, knowing it's between probably 10 and 20x, and I was a little more conservative and said it's probably at least 6x. I adjusted a cohort analysis that was done by the World Health Organization. It had been peer-reviewed. It had a lot of eyeballs on it by age. It's important to look by age because, again, we have 80% of folks above 60 are the ones largely coming in being detected in both our numerator and denominator, and that's a heavy bias for us. So you've got to look at hospitalization rates and mortality rates by age group and then adjust for your population. We specifically, what I wanted to figure out is this 20% hospitalization rate number. If we're off by 6x, then really that's more like 3%. And in truth, now we're seeing it's probably much lower than that now that we have the benefit of hindsight data. So that's the key number that I took. Just to give you a brief overview, I also did look through what percentage of the population would be infected. This is an extremely important assumption. Then the last things are based off of the true hospitalization rates, the true mortality rates. We can get a good idea of how many are going to end up in the ICU. We know from studies it's about 5% of those that are hospitalized, 5 to 10%, and then 2/3 require ventilations, and then 2/3 of those roughly don't make it. The other important thing that you have to account for is incrementality. I don't hear a lot of conversation about it, but we should. It's important. We have 3 million deaths a year in the U.S. So to say that all of these are incremental is inherently flawed. All right, so that's how I took and got to an adjusted hospitalization and fatality rates, plugged it into the SEER model to get a better perspective, really what our hospitalizations will look like. Because if you put in 20%, you'd end up with like 2 million hospitalizations. Well, we were nowhere close to that. That would have been unrealistic to do from the get-go. I saw some people did that. I don't know what they were smoking, but bottom line is, how do we know how this is, where we're actually at on the curve? Well, now we have data in hindsight that shows us that. Particularly, you can see by date of onset, we were growing 30% day over day, right? Especially through early to mid-March. As soon as we implemented a lot of the social distancing measures and stay-at-home recommendations, and every state, county was different, but ultimately, right around the middle of March, it was March 17th, and you see a marked change on that day. From the 16th to 17th, it goes from like almost 30% trended down to like 16%, and then it's been steadily down all the way to like 2 to 4% since then. And we continue to see ourselves stay in that range. So how do we know hospitalizations peaked? Well, the CDC tracks emergency department visits, both inpatient and outpatients. You can see right here, both COVID-like illnesses as well as flu-like illnesses peaked a long time ago, guys. This is like 5-6 weeks ago, and they've come down steadily ever since. Also, to give you a good representation, some of you may be looking at cumulative COVID hospitalizations. These are lab confirmed. The one I just showed you is not lab confirmed. That's literally anything that looks like a COVID-like symptom they're counting. So that's a much more conservative figure. This is truly they've tested positive. The entire time, I'll call it from March 1st to May 2nd, the last 2 months, we've had 16,000 cumulative. Now, this is a small percentage of our hospitals. I don't want to misstate the data to you. I want to put it in context. However, if you look at where that peaked, again, it was middle of April. The subsequent growth since then has been rather small. And these are not active hospitalizations either, right? This is just anytime somebody ever went to the hospital. In closing, I'm shocked that not more people were saying this. There was a small group, IHME, out of Washington that was saying this early on. Other institutional models have started to come online, but you just don't hear a lot about them in the media. And that shouldn't have been the case. I'd say anybody worth their mettle in this field should have been able to do these high-level adjustments and know that this was likely where we were tracking. I'm a little concerned that politics and media bias has started to creep in here and unduly influence us. So I think it's important that everybody looks at the data yourself, and more importantly, whatever your source of news is today, whether you're Republican or Democrat or wherever you're at on the spectrum, you should be checking the actual data against what they're saying are the predictions and comparing. And then you should start listening to whoever's the most right. Thanks for tuning in. I hope somebody got something out of that today. Have a great day, guys.